Do you have any data on the frontline workers, like these healthcare workers? What is their rate of getting infected by COVID-19?
So the infection rate is very low. We don't have any hard data because
Okay.
it's hard right now to tell based on the number of cases we have in our hospitals. Like I said, most of these people that are reporting that they have symptoms are getting tested at external facilities. So these are those in Korea, you'd see those drive-in swab facilities.
Yeah.
Most COVID-19 patients, and I can only speak to Alberta for this because I work in the healthcare system here, there are only 42 out of those 542 cases that went to a hospital. And of those 542 cases, only 20 went to intensive care. So it's a very
Okay.
small proportion of our overall population, at least in Alberta, that is hospitalized. And
Okay,
so it's
so
a low
so
chance
you're
for people to be infected.
okay, so and because of that, then maybe still the biggest threat, or you could say the people who are at risk of exposure, is the community.
That
Would you
is
say?
correct. Yeah.
Okay, so
So
it's not
there's
like they
something
have at this
in
point an extra higher risk, the hospital workers, like statistically.
correct. Yeah.
Based,
But
yeah.
all
Okay.
hospital workers are trained to put on and take off their personal protective equipment, their PPE. And really, it is the taking off of that personal protective equipment where we have the highest risk of potentially infecting yourself.
Okay. And now, what are we looking at in terms of when will this peak? Because a little orange birdie told me that Easter, it's all going to be good, and we can walk out of our houses, and it'll be gone. It'll be business back to normal.
I mean, I suppose if you lived in a bubble and you isolated yourself in a bubble, Easter would be fine.
Yeah.
That is not the case. So in
Okay.
epidemiology, we have something called the R naught, or the doubling rate. It is R naught is the number of people that gets infected from a virus. So for the flu, it's a rate of 2. One person infects 2 people. For COVID-19, it's somewhere between 2.5 and 3. So for every one person that's infected, 2.5 or 3 people get infected. And because we're still seeing an increase in the number of cases that are getting reported for infections every day, this thing will not peak for at least a couple of weeks. I would say even a couple is being very generous. I would say somewhere between 8 and 12 weeks. So we're looking at either early July or mid-July as a peak, not as an end.
Okay. So what does that mean when it peaks? Because that's a good point to make, that it's not an end. So when it peaks now, do we reduce these measures or ease these measures? What are we looking at then? Once this peaks, how long do we have to keep some of these precautions in place?
So I would say absolutely please don't end the measures when we have the peak. The peak is only when you're at the top of the curve. Then things are going to peter out again, and that's going to take another 6 to 8 weeks after we peak for this infection for things to go back to quote unquote normal, whatever that new normal looks like, whatever that new world looks like. So all said and done, we're looking at a minimum, a bare minimum of at least September, October.
Wow. September and October.
Correct.
So then, do you think, from a public policy perspective, that these measures will then remain till September and October?
Absolutely, and that's the guidance we're getting out of Health Canada too, is that these social isolation, these self-distancing measures will not, or sorry, these self-isolation social distancing measures will not be lifted for months. We're not talking about weeks anymore. We're talking about months.
Okay. Now, is there any talk about isolating cities? Because that's what they did in Italy. They started quarantining cities themselves, because right now you can travel interprovincially, you can travel to other cities. There was, some articles and social media posts about earlier last week, people were taking this opportunity to go on vacation, different within Canada, obviously, but they're traveling to different cities and lakes, mountains, things like that. So is there any talk about isolating or quarantining cities and provinces?
Currently, there's no talk of isolating cities or provinces. I know it has been discussed at higher levels, But right now, that is not on the table for us. The biggest thing is if we continue with these social distancing and self-isolation policies, where people are, one, admitting that they might have symptoms, and two, being proactive to take care of themselves, and more critically, those in their immediate circles. So I'm talking about their children, their friends, and most critically, their parents, making sure that these people are not being potentially exposed or infected with the virus. If we can limit our number of cases, then we don't have to go into quote unquote lockdown and isolate cities or provinces.
Would you, given this timeline, would you think then it is intelligent planning for, schools, universities to plan for at least until maybe even the winter semester, so until like after December holidays, to have all their classes, everything online, rather than trying to rush kids back to school?
That's also my concern, is that if we get a peak by, let's say, mid-June, things start to calm down in August, and then everyone goes back in September, there's still going to be these isolated individual cases or little pockets here and there, just like that curling event that you had mentioned earlier, where you're going to have one or two people picking it up. But because now people are packed into classrooms, they're packed into restaurants, they're packed into locations again, events are going on again, that transmission is still going to spread. So my concern is that we might have a first peak in July, but there's potential for a second peak in September or October. And then all of the work that we've done now will have to be repeated again.